Hello, everyone. It's Melissa from the Sport Fibromyalgia Network. I just wanted to jump on here. It's Friday for a Friday chat. I called it a Friday Fibromyalgia random chat because, I just wanted to make sure to check in with you. Was starting to prepare a slide deck and a topic that I was going to promote for today, and I got sidetracked with the way this week is going. And I also didn't get good sleep. So I was like, you know what? I'm just going to nix it. I'm going to jump on here. I'm just going to have a chat with all of you. So if you're tuning in live, let me know where you're tuning in from by posting a comment. Please, I'm not, just like it. Let people know about the Support Fibromyalgia organization and all the work we're doing. I love to get more people involved with the organization. We have a lot of activities coming up. So it'd be great to connect with all of you out there and just let us know where you're tuning in from. Hello, good to see you. Is it Rangel? I hope I got that from, I guess, Texas. So nice to connect with you this morning or even afternoon where we're going. So it's lunchtime for the East Coast people. It's morning. I have again not really slept, so that's where I don't really like impromptu presentations, but I'm really trying to get going with regular live streams. So if you guys have questions, we can just have a random chat and just go at it for maybe a half an hour and see how long I can talk and stay awake. I did have my coffee super early just because the lack of sleep was quite interesting. So I've been struggling with my sleep lately. I had gotten into a good rhythm, and then all of a sudden, again, it just changes on me. But last night, especially, was tough because you could feel like as I was starting to fall asleep, all of a sudden you hear that coyote howl, and my dog just like goes nuts. So it was just jumping around and barking away, and you hear the coyote keep going. So I live in the Pasadena area of Los Angeles County, but we have neighbors so close by, but we have so much wildlife. So I've been taking a look at all this stuff. It seems like my vegetable garden is very popular with the rabbits, rats, raccoons, bobcats, skunks. So even all last night when I checked into Arlo, because I moved the camera around because I was interested to know who was eating the lettuce. I've been leaving some lettuce for what I thought was the rabbits, and now I've learned and it was hilarious. I logged into Arlo like after the coyotes woke me up at like 5 a.m. and I looked at Arlo and I was seeing what activity. It was like a buffet. It was just like a buffet of different critters coming into that spot with Arlo watching it. So you see this big rat with his like butt up against the camera, just munching away on the lettuce out there. Then the skunk rolls in 30 minutes later, and then the rat comes back, and then you see another raccoon just stroll on through. It's comedy. So this is what I've been entertained by for these months and year, for just looking at the wildlife outside. I do miss the rabbits. I was enjoying seeing them just during my breakfast time out the window, just out there in the garden, munching on the grass and the leaves and stuff like that. So I hope they're okay with that coyote out there. Definitely heard the coyote last night just howling away, and then I guess there were some other coyotes that joined the pack out there, so my dog was definitely not having it and barking away, so I didn't get much sleep. That's why I just nixed the presentation, because I wanted to go into some of this questions that Rangel had said. I'd like to know what kind of specialists and treatments work for you and others. Okay, that's a great question, and we can lead into that too shortly. Let me just do a special announcement that I wanted to make before we get back into the question. So I'll just bring that back is this coming Thursday, September 30th at 11 a.m. Pacific time, we are going to be interviewing two integral members from Swing Therapeutics. So I'm excited to have them on the live broadcast. Please tune in live. We'll be posting the event information. It's a free broadcast. We're going to be broadcasting on these channels, so you can watch it on Facebook, YouTube, and Twitter. So we'll meet a couple of the integral team members that I've been talking to. I'm really excited about this. And you've seen the press releases in Pain News Network. I included that link in the description. Tech Munch. So just to give everyone a brief overview. So Swing Therapeutics is a digital therapeutic startup, and they received an FDA breakthrough device designation for their 12-week smartphone-assisted fibromyalgia management program. The platform is designed as a treatment management tool. And they did see in some of the pilot studies that the scores were improved on the Fibromyalgia Impact Questionnaire. And then Swing completed enrollment for that pilot study, and they adapted the treatment for fibromyalgia. The study is ongoing, but they're also now recruiting for a large scale study called React FM. So when we do interview, we'll interview Steph and Jeremy. I'm excited because I've been talking to them for a while. Actually, if you attended the Looms for Lupus event in May, they were part of one of the breakout rooms speaking and presenting. So you may have already connected with them, but we're going to do a live broadcast over the fibromyalgia channels in social media. So please join, please ask questions. I know some of you have already enrolled and are testing it or did the pilot study and testing it. So I'm excited for this for multiple reasons. And it's beyond maybe what the application is actually helping with, but the accessibility, it's on the smartphone. So we can reach more people with a treatment tool for fibromyalgia. And when we're talking about healthcare disparities and looking at that and seeing how we can get it into the homes of people and make it affordable, right? This is something we're noticing with some of the fibromyalgia research investment. Like they're investing in tools that they're noticing do help. And there's been a lot of investment sometimes with the NIH, but how accessible and affordable is it for fibromyalgia patients out there to access the tools? So that's the question, and that's why I'm interested in this. So I know there's been some questions on like what it's about. Well, it's, but it's nice to have technology driven companies involved, startup driven companies who really care about the fibromyalgia community. I've had a chance to talk to Steph and Jeremy. They really do care. There's human beings behind it. It's technology driven, so we can increase all of the exposure for fibromyalgia within technology companies. So that's what excites me, because there can be more of this. There can be more accessibility, bringing these applications into your home, affordable, free applications, and build off of there rather than tools that you may have to go drive somewhere. Maybe it's an hour or 2 hours away if you're living in rural parts of the country or remote parts of the country. Or it's just super expensive because it's not covered by insurance. So what tools can we provide the fibromyalgia community at home that you can use day to day that doesn't cost you much? And it just makes it super accessible. So that's why I get excited about this type of tool that's coming to the fibromyalgia community. And of course, they are interested in getting to know the fibromyalgia community. So that's even more important. Hey, Kate. Oh my gosh, I haven't had a chance. I love Kate. So, Kate, we should definitely do an interview if you're open to it at some point. I know Kate has been busy working and moving and transitioning from different states and stuff. We wanted to do an interview with Kate. So at some point, Kate, please definitely reach out for an interview. Okay, let's get back to some of those questions. Sorry, Rangel, I moved over and digressed. That's why it's called random chat. So I gulped down my coffee this morning. Probably need more coffee because it's already been, I think I had coffee at 7 a.m. So it's already going to be 3 hours later. So I probably need some more, a little bit extra boost here, or if I can find some energy to take a nap, I will. But you're asking about specialists and treatments. So if other people want to chime in, please chime in. And if you're watching the replay, you can feel free to answer the question as well, with what kind of specialists and treatments work for you and others. So I've had a long road with this when it came to who I would work with and what actually helped. I feel like I can get some information from standard of care like MDs, but what I'm noticing is that I respond better to more naturopathic medicine. I wish and I hope one day that it'll be universally covered by insurance purposes, but I know that a lot of these doctors spend so much time with us in our appointments that the MDs and maybe standard of care doesn't. So that's why it's hard for them to be billable insurance, or don't make enough that way for out-of-pocket costs. So it's difficult. And my example now is with stuff that's going on with my gallbladder. So we did the ultrasound. I do have gallstones. We think it's these attacks, which I haven't had fortunately since September 3rd, because I've been able to use some of the naturopathic care of food and switching some things up and some supplements that have been helping me. But when I talk to the MD, the GI specialist who did the ultrasound, like they want to just remove my gallbladder. I'm like, no, I don't want to have surgery right now. Let me try something else. But it's really this push, right? You don't know, and then you're trying to tell them, well, I'm going to change up my diet. I'm going to take some natural supplements that for the gallbladder that I've seen. And they're like, well, that's not going to work. And I'm like, well, it has been working. So this is, many of us, I think, in the fibromyalgia community might fall in this. And this is an interesting topic. So I'm glad that you brought this up with what may not work. And I think we need to expand the care of specialists and look for different ones, and not only train primary care physicians. It's where we're trying to get Project Echo off the ground. So at least we can give some continuing medical education for primary care physicians and other people, because it's a wide spectrum. You hear functional medicine right now. That's been a hot topic, integrative medicine. So what does that look like? But again, you're looking potentially at people that you need to pay for out of pocket. And I don't know how people get around that. In the fibromyalgia community, if you're on a limited budget, it's really difficult. So I think we do need to train our primary care physicians at least on how to help get allied professionals surrounding the treatment plan and protocols, so that you can have an allied team together, like physical therapists. If you respond okay to chiropractic treatment, that's an option. But I know we're moving away from specialists like rheumatologists, because even if you look at the American College of Rheumatology website, they defer to primary care for the treatment. They can help diagnose you with fibromyalgia, rule out other autoimmune conditions, but they're deferring to primary care physicians. So these are conversations we need to have. And I mean, supplements, I tried, dietary changes were big for me, sleep, hygiene. And now I've gotten better. So looking at those foundational pillars are important. So in functional medicine, the foundational pillars are nutrition, movement. And by movement, we mean not overdoing it, like functional movements, at least just trying to move your body. And you can do it how you want to and do it. Like, some people like yoga. I'm not necessarily a person that's going to be on a mat. I've tried chair yoga as well. I still need a lot of strength. So for me, even things like, dancing or just moving your body, or I do vegetable gardening. So that's kind of how I'm doing my movement. So no judgment on any of this stuff. So you have nutrition, movement, stress management, release, mindfulness, any of that type of stuff too. Community support, relationships, because we know how various relationships can have a negative impact on us. Sleep is super important, and getting that sleep. And again, this is where it's really tricky with standard of care, like pharmaceutical prescription medications versus supplements. I'm on the supplement side because I've tried a lot of prescription medications. I would love to be one of those that takes a prescription med and just knocks out with sleep. That would be so amazing. I've seen people on that like, oh yeah, I just take it and I fall asleep right away and I get good sleep. I've never had any luck with those. I've always had side effects, or they just didn't work. They got me really hyper, reverse effects. So I've always had to do more supplements, individual supplements, but it gets even harder for me because there's some sleep supplements out there. They're marketed, they're labeled, but they have different ingredients in there that I'm sensitive to. So for me, the challenge is I take one individual supplement each separately. Sometimes if there's a combo, I make sure that I've already tested myself with that particular supplement individually, and trying to figure out dosing is even harder. So it's definitely, but I've never been able to respond well to prescription medications, even when it came to thyroid related stuff. So it's a journey of working, and that's where we're maneuvering through standard of care treatment where it's covered by insurance versus naturopathic care. You are on the right track. So let me go through some of the comments that are coming out. So gallbladder, okay, I've heard this a lot in the fibromyalgia community that we're getting the gallbladder removed quite a bit. So the food, it's tricky because I've also I supplemented, I watched every YouTube video on the gallbladder and like what was going on. I really think that that's the thing, although I have an endoscopy coming up just to double check, right? So this is what we're using standard of care medicine for, is to do these ultrasounds, endoscopies, the acute care medical system, and then taking a pause before any surgery and being like, okay, so what can be done in between? Because the gallbladder removal is, according to my doctor, very easy. You can be out very fast. This is just modern procedure. And I've seen the statistics on people that have gotten removed, but I was like, okay, wait, because I'm super sensitive to anything as far as surgery goes. So it's I guess I really dove into the details because this is where like the biohacking, I read everything, watched YouTube stuff with some of the naturopathic doctors that I follow, and go through these. I'm like, okay, so these bitters, incorporating the leafy greens, but bitters. So it's doing some dandelion roots, like adding that to my salad. Those are really, really bitter. And just adding like the sauerkraut, integrating, which I was already starting to integrate, apple cider vinegar. I've laid off some of even the good fats a little bit too to notice that. So okay. So have you looked into a functional medicine doctor? So my story is pretty funny, or it's not funny, but this is how I became a board certified functional medicine health coach to actually try to infiltrate the Institute of Functional Medicine so they can focus on a fibromyalgia care plan. I did in my journey. So the MD's standard of care gave up on me in 2016. We don't know what's going on with you. Your body is just out of control, and they kind of left me hanging. So I went and found functional medicine, and I did see some functional medicine doctors. I paid a lot of money out of pocket. They gave me a lot of supplements. So that's what I was like, okay. And the tests, which I did find interesting. I wish the tests, and I've done a lot of outreach with those companies about those functional medicine tests to see how we can get them more accessible or affordable. Expensive. I paid out of pocket for those. I was interested. I learned a lot. But in the end, I didn't feel better, even from necessarily a little bit better. Okay, I'll give those two providers a little bit of credit, a little bit better, a little bit of energy. But they left out of so much stuff that ended up working for me, which was intriguing for me. And that's why I started to go down the path of being a health coach. I wish I could go back maybe to naturopathic school. I wish I had time or just even the money for that to become a naturopathic doctor so I can implement this professionally to all of you. But in the meantime, as a health coach, that's what I'm giving away, this information, because if it helps people, that's my goal. But I think that functional medicine viewpoint in that area still had a view of what fibromyalgia was. There's still a stigma that was associated with the providers that I saw. And I started to do my own research. So I found Dr. Mark Hyman, I found Bulletproof. So Dave Asprey, I went to his conference for biohacking. I was like, what the heck is a biohacker? And I understood it. I'm like, oh, dude, I have a biomedical background, can totally biohack myself. And from his book, Headstrong, I learned about Dr. Terry Walls. Dr. Terry Walls. And I was like, oh, wow, she has MS and she hacked her mitochondria. So I immediately looked up her TED Talk video. I started to learn about her protocol. And then Dr. Dale Bredesen's book, End of Alzheimer's, came out. Conceptually, I was like, I read the book End of Alzheimer's. It's like, this sounds a lot like fibromyalgia. All his different 36 variables that we get affected with our lives. I got to do a video to break this stuff down for all of you because I'm holding too much in my head. But I was reading both of those books simultaneously, created a whole plan, looked at all my blood test values. And there were definitely supplements that the functional providers never talked about, like glutathione. So I want to do a video on glutathione, liposomal glutathione, liposomal PQQ. So these brain enhancers, mitochondrial enhancers, which you're starting to read about now more, which I'm happy about. And I just saw the Fibro Doctor. He did a blog post in his newsletter. He was talking about methylation. So he brings up glutathione. Glutathione's been mentioned as the major antioxidant. And if you're slow at producing, which I am, I have a lot of methylation, sulfation issues genetically. So I have such a decrease in glutathione production that when I started to take that as a supplement, whoa, like my brain just lit up. And I was able to go through that. But no one had ever told me about that stuff before, even the functional medicine doctors. So that's why we're trying to change the scope. but I'm trying to do what I can. I know it's sensitive to be for me, as I'm not a medical provider, to talk about some of these supplements like that. So that's why maybe just doing the educational videos so you can learn about it and see, um, and just go through those. And I'd be happy to share some of the providers I do follow. Again, Dr. Terry Walls, definitely follow, get the book. I know some of the seminars and things might be out of cost range, but if you can, buy Dr. Terry Wall's new revised version book. She has a cookbook as well. Go with the protocol. Ask me for the cheat sheets. I'll send you the cheat sheet pyramids of the Wall's protocol. Her protocol, I'm a Wall's certified practitioner too. So if you're interested, we can even do a Wall's protocol group session through the nonprofit, and we can walk through and I can share with you the Wall's protocol, because I've seen good results. I've gone to the seminars in Iowa. I've seen the people there, and they have autoimmune conditions, MS, fibromyalgia. Dr. Terry Walls has trigeminal neuralgia. So she manages a lot of pain, and she still has MS, but now she's been able to start treating patients again. She's doing research. So I'm a huge fan of the Walls protocol because it starts with food first, which is amazing, because some people ask me about what supplements do you recommend for fibromyalgia? And I know, don't hate on me, but always say food first. If you can start with food first and put your investment into some of the foods and the produce, vegetables, and that's what she really goes for. Like, get your vegetables in, your cups of veggies, leafy greens, sulfur-rich foods, and colors. So when you cut the veggie, it's colored all the way through. Get those in first before the supplements, because supplements, she talks about, is supplemental. If you find you're not getting enough nutrition from the food, then you can supplement. And she does have some supplements she talks about, because things like PQQ or the phosphatidylcholine that she can't necessarily get through food, that is what she supplements with. But she definitely wants people to just focus on increasing her vegetables. And that's what I love, because she's worked at the VA before treating veterans. She has a lot of information. She's worked with a lot of people on disability. That's why I'm such a huge fan of her approach and the behavior change protocols that she has. So I send people the books. If you do have a support group or you want to learn more, I definitely have been sending support groups free books from the nonprofit. And I would love to do a separate webinar or even just a Zoom chat, group chat with everyone, because that's what we want to empower you with, like tools that you can use at home, tools that you can do yourself. That way, if you don't necessarily have a provider right now, or you're still looking for a provider, these are tools that you can empower yourself with right now. Don't need a prescription to look at food the way we can look at food. And I'll break down, that's one of the videos that I actually wanted to do. I have a full slide presentation on the Walls protocol where I break it down, and then I can even connect the dots, genetically speaking, of why it works so well for me. And I love it too, because she has three different levels of the protocol. So there's level 1, 2, and 3. So that way you can go at whatever pace you have, or if you have multiple people in your family that you're cooking with, you can go, maybe some of them can go at level 1 and you're at level 2. So I'll definitely get into it. I need to do a Walls protocol video. I have the slide deck prepared. I even have the image prepared to do it. So I just have to do it, right? But that's a protocol I'm thrilled about for our community. I've seen and heard from a lot of people in the fibromyalgia community that jumped in because I've been promoting it so much, and they've tried it. They've had good results from it. There's also the Bredesen protocol. So if you do have someone in your family system who has dementia, Alzheimer's, Parkinson's disease, any of that, and you feel like also the brain fog issues, like the Walls protocol or the Bredesen protocol, they kind of go hand in hand. And there's an upcoming practitioner seminar for Dr. Walls that I'm a part of where Dr. Bredesen is speaking. So it's very much with brain health, lowering neuroinflammation, which we know is involved with fibromyalgia now. So the Bredesen protocol is another one to look up. There's definitely different providers depending on the degree. Dr. Amy Myers is someone we follow too. She has a lot of autoimmune related recipes. Her supplements are also really good quality. I shared the other day with Dr. Ben Lynch on Dirty Genes. So he has the company Seeking Health, which has good quality supplements as well. Okay, so I'm seeing value. CRP is always high. So this is where you're digging into the inflammation, the root cause of inflammation. What's causing that inflammation? Because this is going to increase pain, brain fog, fatigue. So that's the big thing. Yes, her programs can be. This is where it's hard to make the investment, and that's why I always say food first. Because the good quality type of supplements too, they cost more. So if you can get them in Black Friday deals, they always have or Labor Day specials, they had them. Sign up for the mailing list, keep an eye on discounts, because that's the only way I was purchasing supplements too, because they were so expensive. But I went for the food with Dr. Wall, started eating differently, going outside when I could to get a little bit of sun, getting vitamin D, was able to do my blood test to see my vitamin D's go up. I think like that's where it was. It's just trying to figure out how much you can get through food, how much can you tolerate, and then just monitor it. If your primary care could at least like you can let them know, hey, I'm going to work on food first approach, but I need your help with maybe measuring my lab values. So that's something they can do. It's covered with insurance. So your vitamin D is low. How can you increase your vitamin D through food? Maybe some natural ways like getting outside and sunshine. It doesn't have to be a lot of time. And then I learned something in some of the biohacking videos that can go out earlier in spring when it's not like blasting hot with the summer. Start to build up a little bit of tan if you can tolerate the sun. Just go out for a few minutes each time in the spring where the sun is not so intense, and you start to build up even get a little bit of a tan so you won't burn. I don't know what it is with everybody goes out in the summer and they suntan and they burn like crazy. No. So you're starting to just continuously get a little bit of sunshine. Just try to convert that. And some of us are not good converters. I'm one of them. Yes. So all the potassium combined with the vitamin D, which they don't give in the prescription, by the way, when they prescribe you. So, I'm sorry, your primary care was horrible. I'm here. I'm still searching for a primary care. My mom is on my case. She's like, you got to go see my primary care. You need to make an appointment. And I was like, I'm a little hesitant. It's an MD again. I'm just not having luck with MDs because I'm like, this prescription stuff just doesn't work for me. I don't know what it is. I haven't had any luck. Even with, like I said, prescription or type of thyroid stuff, it's always the natural stuff. And people and the MDs they're like, well, we don't use that. So I can't even give you that information. So, if you're stuck in the middle like me, I definitely feel your pain and struggle to find. I get excited when people have such good care. That's good news. So I know not everyone is out there when it comes to managing that, but it's trying to maneuver through this with ways that we can explore, and that's why I like having these conversations. So thank you, Rangel, for posting and being so engaged. I'll definitely. I think if I just to let everybody know, my personal account. So when I was doing some of the live broadcasts, I was giving out links to the Institute of Functional Medicine related to some of the news that's happening. I will not say it, but Facebook put me in Facebook Messenger jail. So it's been hard to message people. I'm going to check today after this video to see if I'm out so I can finally message, but I'm not ignoring anyone. I promise. I just can't send messages because they put me in Facebook jail for a little bit. So if you're out there on Facebook, I apologize, but I definitely want to get the information to you. So I'll add links to Dr. Terry Walls, but you can email me at melissa@supportfibro.org. Just email me and I'll send you the cheat sheets. My email works fine. So send me an email and I'll definitely send you guys, whoever wants it, the Walls Protocol cheat sheets. If you're interested in a group type of Walls Protocol work, I'd be happy to put one up because, like I said, I can talk all day about the Walls Protocol. I use it all the time. I use her book as a reference all the time. And, I'll even, we can work on things together. So the email is melissa@supportfibro.org. And then you can reach me at Melissa Nerdy Talwar. Hopefully the messenger works. But also what you could do is just post on my Facebook page. I will get you the cheat sheet. So there's 3 cheat sheets. And like I said, it's more like the food pyramid that we learned in school, the nutritional pyramid from Dr. Walls. So, but this is her version. So it'll show you the 3 levels and you can start through. But I highly recommend getting her new revised book and go through it slowly. There's a lot of information. She gives you great information. I cannot thank her enough for, I was at the seminars. I went to Iowa. I was in the Functional Medicine Coaching Academy class. But again, I'm always the patient first. And her seminar, she gives you the same information she gives the providers. And even with the coaches, when I was doing the certification with her class, I had a one-to-one with Dr. Terry Walls. So I was the only one at that time being certified. It was awesome, but intimidating because she was asking me some of the questions. We were going through the case studies. She's like, okay, based on this case study, what would you do? I was like, oh my goodness. Okay. So I had to be really on it. And just to let you know, they were hours ahead. So I was taking it at 7:30 a.m. in my brain. I'm trying to make it work. And I'm like, oh my gosh, I'm with Dr. Terry Walls directly. So I train with her and her team directly. But it's such good experience to learn from her because she just gives you the information, even as she doesn't change it. Like some programs change it because I'm a health coach. Nope. This is about being with practitioners. I am with the other practitioners in the group. So anyone that's an MD, ND taking it, I'm part of that group. So I'm learning the same material. And she has a lot of material to share. We talk about oral health, even with the Bredesen protocol. We get into it, like what things to look for in the tongue, analyzing gait and how people walk. So much. So it's awesome. So if you can, definitely check out Dr. Terry Walls. She's on Facebook. She's done great work, at least starting there. And like I said, it's food first for her. And that's something that gets missed again with whoever you see. If you get prescription drugs over there and maybe get overloaded and you can't even tell what's doing what. Or then on the other side, you get a lot of supplements. So there you pay out of pocket for all the supplements. You might be overdoing it. You don't know what's helping, what's not helping. And with gut health, it's like you might not even be absorbing the supplements. Or if you're taking too much of different supplements, you could just be peeing it out and you have very expensive pee. So this is just like, that's why I said the easiest thing might be just to go for food. And I know we're talking about food insecurity, food access, but if you can do getting the vegetables in, and we've brought in some videos on accessing good quality food, even at different stores. I like it that Walmart is putting a lot more effort into good quality foods and just read those labels. Turn it, if you're doing frozen foods, go for the non-seasoned ones. So it's just the vegetables. Even if you're working with canned vegetables, adding more vegetables to your life is super important. And diversity of vegetables. So don't just go for the potato vegetables. Like we're talking about different colors and have fun with it too. If you have a family, play with the rainbows color theme, like the eating your rainbows. And so you can play with that with your family, just add different colors. Purples, like blues with blueberries and different colors that way, greens. So try to enjoy it a little bit. And even if you don't have kids, have fun with that. Yes, I love the dark greens. It can be some bitter. If you do have digestive health, like maybe try blending them or steaming it, because that's what I had to start out with. Smoothies, I was getting my veggies in through a lot of smoothies. Because that was the easiest way for me to digest, because raw was really upsetting my stomach when I first started to make these transitions as well. A lot of gut issues. So that even means I wasn't necessarily absorbing some of the nutrients from the supplements. So these are there's all kinds of things to troubleshoot. And, I'm just trying to figure out the best way to deliver it. It seems fun to have these live so we can chat together, but maybe we should just do this like in a group setting with Zoom. And anyone interested, if you're watching the replay, just also reach out as well. Is that enough randomness for you? I think I hit the points for some of the stuff that I wanted to talk about, at least. I love this that people cue conversations because we can interact this way rather than me being so prepped and formal. So thank you so much for joining us. Definitely tune in Thursday at 11 a.m. Pacific time as we interview. Thank you, Ringel, for tuning in. It's fun to engage. Like, we got to engage in person. I'll visit Texas and come and visit you after this pandemic kind of dies down. Because we have good friends in Texas over there. So shout out to all our advocates in Texas, moving forward with that. We have still some advocacy going on. We did send our emails. I'm going to bring back Crystal and Estella and Juana. We have to talk about some of the advocacy efforts because we sent out some emails. We're waiting for the response. We'll make some special announcements with that as well. Oh, I forgot to tell you about the floating balloon. So Estella was nice enough to give me a balloon for my birthday. So I've kept it out in the room, the entryway. So it reminds me just of kind of like, good things are ahead. That's what also woke me up last night. The balloon, I don't know, it's been traveling around. I don't think it traveled through the video yet, but it's like right over to the side over here. And it ended up in the room right above the air conditioning. I kind of freaked out because my dog was already barking with a coyote. He finally came back to bed, and all of a sudden we hear this crinkling, right? And I was just like, what was that? Because the first thought was, again, oh my gosh, I have a rat in the house, because that's all I've been thinking about, the rats invading my garden. And then so the dog started growling. I was like, oh no, maybe it is really a rat or some sort of lizard that's entered the house. But it was that balloon, the traveling balloon. It landed on the air conditioning. It was making all that noise. My dog took off anyway, but I was just like, oh, so I don't know, it's been floating around the room. I was hoping it would maybe travel so you could see it just floating around. But again, randomness, right? Fibromyalgia randomness chat today for our Friday. But tune in to our live broadcast. It will not be random with Swing Therapeutics on Thursday at 11 a.m. Pacific. We will be interviewing Steph and Jeremy from Swing Therapeutics. They're going to go through more information on what they're working on and the new launch of React FM. So stay tuned for that. Thank you, everyone. Have a wonderful weekend. I'm going to be taking a chronic pain and chronic fatigue class with Dr. K. He's another person to follow. I'll put these links in. He switched from Facebook Lives, I think, to podcasts, but he wrote a lot of books. One of the big ones is The Thyroid, like Why Do I Still Have Thyroid Symptoms? Super smart guy. I wish he was taking patients because I would definitely pay a lot of money for his analysis. But he has a lot of free videos too, and a lot of information, really good information for thyroid, autoimmune conditions. So tomorrow and Sunday, I'm taking his full class live streaming for practitioners on chronic pain and chronic fatigue. So I've been waiting for this class. I'm really interested and going to do that. I'll definitely share a link for his page. It's so that way you can find it and follow his information, and you can watch his videos. He does Facebook, YouTube, Instagram. He posts his videos, and now he has a new podcast. So he has an incredible amount of information to share. So I'm excited to take this course from him. I missed the neuroinflammation course, but I think I'm going to catch up after this. And I've been catching up. I'm getting certified for the Recode 2.0 with Apollo Health as well. And then I have some other certifications I'm finishing up, potentially along supplementation, which hopefully opens this up. And then Great Plains has their event. I'm doing the live stream in November. So there's a lot of stuff coming up, and I'll be sure to share with you what I'm learning, because that's the idea, right? Empowering all of you to get this information in your hands. I don't like barriers. I think as patients, it's the 21st century of medicine. We're empowered, we're knowledgeable, and we can totally do this. So we need to catch up those healthcare providers and get them to understand and bridge the gap. So that's why I became a health coach, to help bridge that gap of communication between patients and providers. It's got to happen because they're not, for some reason, the communication line has changed and we need to build it back in. It's definitely going to happen, but we really need to build it back in, make it succinct, let people know, let tech companies know, pharmaceutical companies know that patients are really smart and we are in charge and we know what to do and we're empowered. Again, 21st century medicine, not 20th century medicine. We've moved forward. We're learning. We have these resources over social media. We're digesting content more than ever. So bring us into the fold and give us a lot of credit because we are super empowered. We're learning. Sam Rez Rangel was mentioning in the chat all the things she was doing. We have a lot of knowledge. So that's why we just want to continue to share here on the network and yeah, keep sharing. So have a wonderful weekend. I'm going to be studying all this this weekend. So you never know, I might jump in between lunch hour because I'm super excited. I'm going to be braining out on inflammation, chronic fatigue, chronic pain. I want to see what he says in his perspective. Again, this is for practitioners. So I'm going to be learning what the practitioners are learning. So I'm definitely going to chime in if I'm like thrilled or upset. I'll try to do my best to maybe log in and do a chat or maybe do a recap of what I can share from the class. So thank you, everyone. Thank you for enjoying the random Friday Fibromyalgia chat. I'll check in with you soon, but definitely put in your calendar Swing Therapeutics next Thursday at 11 a.m. Pacific. We'll see you then. Bye.